Can the officers that are joining via Teams, can they hear me?
Yes, thank you.
You can now. Sorry,
Very
I just
clear.
had a
Thank
technical sorting out to do. Good evening, everyone. Welcome to the first meeting of this municipal year for Children's Services Overview and Scrutiny Committee. My name is Luciane Bauker from Democratic Services, and can I have, please, nominations for chairman for this municipal year? Yes?
Could I nominate Andrew Middleborough, please, for chair?
Yes. Any other nominations, please? No? Could I take a vote on Andrew being elected chair?
Do you need a seconder?
Can I have a seconder? Beth, okay. Can I have a vote, please? All those in favour? Yes? Yes, it's been unanimous. Thank you very much. Andrew, you've been elected chair.
Yes, sorry, apologies. I see that all of the committee members are here.
I have apologies from Shirley Boyd, and she sent a substitute, Councillor Alistair New substituting.
Good, thank you, Lucy. Interest.
Can I ask if I need to stay in time?
I'll make a record of it, but it's not really an interest because you don't gain financially from that position.
Okay, thank you, Beth and Luciane. Okay, agenda item 5, minutes of the previous meeting. Now, I note that there were only 3 of the members of the current committee who were present at that meeting. That was Anne, Morag, and myself. So when we come to approve those minutes, I'll ask for just those 3 people for their approval. Does anybody have any amendments, suggestions, corrections to those minutes? Thank you. Any comments, matters arising out of those minutes? Anne?
Yes, a matter arising. I was just wondering, it said that there was that they were making plans for, sorry, I haven't got the exact thing in front of me, plans for school transport for the coming September. And I just wondered how that was going, because there was a bit of a problem last September. So that's...
Thank you, Anne. Is there an officer who could respond to that?
Councillor Cabra, it's Sal Thirlway here, Assistant Director for Education. I'm afraid I've got bandwidth issues, so I'm having to keep my camera off. I'm afraid that I'm not able to answer directly this evening, but I'm more than happy to put in writing a response to that query, if that's helpful for committee.
Yes, thank you.
Yes, thank you, Sal. Just one suggestion with respect to such written responses. I'm just wondering whether it might be possible to consider including those written responses in the copies of the minutes going forward to the next meeting, so that we can actually see, members can see what the written response was in advance of the meeting. Pauline.
I'm a little bit puzzled as to why I'm down as an other councillor present, because I was under the impression I was actually a member of the committee.
That was probably a glitch with the software. I'm sorry, I'll change it.
Thank you.
We do apologise, Pauline. Okay. Does any other member have any questions or comments at all about the minutes of the previous meeting? Because I, true to form, have three, I'm afraid. Firstly, I note that there are vacancies for 2 parent governor and 2 diocesan representatives. This has largely been the case for all of the time that I've been a member of this committee. I believe that it would be beneficial for there to be two-way engagement between this committee and such representatives. Can officers confirm, firstly, if there is a requirement that we have positions for these representatives? Is this actually laid out somewhere as a requirement? And secondly, could officers try again to get these posts filled and report back to the next meeting? I know that efforts have been made before, and thank you for that, but I do believe that these are very important positions that we should do our utmost to fill. Page 11, new care leavers accommodation on Reading Road. I'm just wondering if there's an update on the possibility of members meeting with residents to gain their feedback. And thirdly, on page 13, there's a reference to the Youth Council. Does the Youth Council produce minutes? If so, I suggest, if it's willing to share these, that it might be useful for this committee to know what sorts of concerns and suggestions they have. And I also wonder if there might be a way for members of this committee to engage with the Youth Council, perhaps asking if some of their councillors, the youth councillors, would like to address one of our meetings or to meet in some other way. Are there officers who could respond to those 3 points, please?
I can respond to the first point. It is in the terms of reference that we seek to have parent governors representatives, and you're right that we have written to the diocese and invited parent governor representatives too. And the diocese is both the Church of England and the Catholic Diocese. Every single time I contacted them, they say they don't have capacity, but I'm quite happy to try again.
Thank you, Lucienne. Can anyone respond on the other 2 issues, Reading Road and the Youth Council?
Chair, if I could come in on the Youth Council issue. The Youth Council has been meeting regularly, and they have engaged in a number of thematic conversations. A note is kept from the meeting. I think it would be very good to engage with the Youth Council in a discussion about them perhaps coming to Scrutiny Committee, as you suggest. I think they would be really up for that. They're a very engaged and engaging Youth Council.
Thank you, Helen. I see, Beth, you had your hand up. Is it on this point?
It's on the general point of having a half and half meeting when new councillors are not familiar with officers' faces to recognise who they are. And I certainly can't see the names at the bottom of the screen, know who's speaking. It would be useful for them to say who they were.
Thank you, Beth. That's a very, very valid point indeed. Once we have approved the minutes of this meeting, I will ask all of the officers to introduce themselves. I'm terribly sorry that I didn't do that from the outset. Graham?
Yes, it's just a quickie. Oh, here we go. It's just a quickie, Chair, on this point. In fact, as part of the Ofsted, we are encouraged to engage with the Youth Council, so I utterly endorse the actions.
Good. Thank you, Graham. And I think, Helen, you will ensure that this action is followed up. And any comments at all about a visit, a possibility of a visit to the care leavers accommodation in Reading?
Could I, Councillor Mickle, it's Adam Davis from Social Care, if I just respond to that. I understand we're part of the Corporate Parenting Board. We're looking at that request in relation to one of our other premises, because Reading Road isn't unique just to care leavers. So whereas the other premises, which we've discussed, I believe, at Corporate Parenting Board in relation to looking at that and taking it to their community meeting at that premises, and I believe we're still waiting for the response of that to be fed back to the Corporate Parenting Board.
Thank you, Adam. If there were members of Children's Services Overview and Scrutiny who are not members of corporate parenting but wished to take part in, should such a visit be organised, might that be possible?
I think as we discussed at the Corporate Parenting Board, I think we'd very much have to discuss that with the young residents, bearing in mind it is their home. And I'm just about, I suppose, the numbers. So we just need to have that conversation with them, which is what we were going to do. So I wouldn't feel I was in a position to give a response to that, other than saying that would need to be subject to consultation with those young people themselves.
Absolutely understandable. Thank you very much. Are there any other questions or matters arising out of the minutes of the last meeting? Okay, if not, then may I ask the three of us who were present at that meeting if you could raise your hands if you are happy to approve those minutes. Thank you. Yeah, sorry, 4. Thank you very much. That's unanimous. I'll sign those minutes after this. Agenda item 6, public questions. I believe there are no public questions. Agenda item 7 is members' questions again. I believe there are no members' questions. Okay, I did promise that I would ask each of the officers who are present virtually tonight if they could introduce themselves and also just very briefly outline your areas of responsibility. Sorry, it may be that you didn't hear that because I've just realised I didn't have my phone, my microphone on. Okay, so if we could ask each of the officers to introduce themselves and to outline their areas of responsibility. Perhaps starting off with Helen.
Thank you, Chair. Good evening, everyone. I'm Helen Watson. I'm the Interim Director of Children's Services. I've been enrolled with Wokingham since December 2022. The role of Director of Children's Services is a statutory role that covers everything to do with children from early years through to child protection, safeguarding, etc., and education. Yeah, it's a very positive role to undertake. Thank you.
Thank you, Helen. I can see Adam.
Hi, Adam Davis. I'm the Assistant Director of Children's Social Care and Early Help. So that covers the full, I suppose, breadth of offer from early help through to front door, MASH, multi-agency safeguarding hub, front door, social care, long-term teams, that's children in need, child protection, looked after children's teams and care leavers, fostering, youth justice, as well as children with disability services, including a residential provision. We also have we were discussing earlier, a care leavers provision as well. So it's a full breadth and range of social care services ranging from pre-birth up to 25 years old.
Thank you, Adam. Gillian.
Evening, colleagues. Gillian Cole, Service Manager for Schools. I sit in Learning Achievement and Partnerships, which is the directorate that Sal is the Assistant Directorate underneath Sal. And my responsibilities include support and challenge to all of the schools in the borough, as well as a number of support services that we run for schools across the borough as well. And in my line management, I also have governor services as well and traded services for schools. And of late, I have been working on the COVID response, but more recently on the Ukrainian response in children's services.
Thank you, Gillian. Sal, and welcome back, Sal.
Thank you very much. I'll try on camera just so that people can see my face, and then I will turn it off. But I'm the Assistant Director for Learning Achievement and Partnerships. So in essence, that's all things education, and my directorate area covers our 0 to 25 vulnerable learners, so our arrangements for children with special educational needs and disabilities, the virtual school, early years, school admissions and home to school transport, school attendance, school improvement, as Gillian has outlined, adult and community learning, NEET prevention, education, psychology, as well as the medical through pupil referral unit. and various other elements in terms of our partnerships with the early years and schools sector.
Thank you, Sal. I see the initials DC on the screen, and I believe that's David Cornish, Councillor David Cornish. If that's correct, are there any other officers present this evening who we have not heard from yet? No, thank you very much indeed. So moving on then to agenda item 8, key performance indicators. Just before we look at that agenda item, I'd like to suggest that all members have had the report and so do not need a detailed introduction or overview by officers. What I would suggest is that we ask for any points of clarification or questions arising from particular dashboards first, and we go through each dashboard in turn, and then overarching questions and recommendations. And I think that it's the latter that are a particularly important function of this committee. So who is going to be presenting this?
Chair, Sudeshna Banerjee is on annual leave, and Rachel Oakley, who's the Assistant Director who leads that part of the service, is unfortunately poorly with COVID. So between Adam and myself and Sal, I'm sure we can cover off any particular questions rather than introduce the report in a formal way. Thank you.
Thank you, Helen. Okay, are members in agreement if we go through each dashboard in turn, asking for points of clarification, specific questions first, and then we'll move on to some overarching questions. So any member questions at all on dashboard 1? Okay, Anne first. Thank you.
Thank you. I just wondered why the number of educational health care plans has gone up so appreciably in Q4 21 to 22, please.
My apologies. A bit of a technical issue there. In terms of the current EHCPs that have gone up, we are seeing a greater need for assessments or a greater pressure on requests for placements. So the population of children presenting with additional needs with SEND is impacting on our EHCP levels rising. It's also creating for us some pressure in respect of the EHCP issuing within the 20 weeks. We are seeing a significant rise in terms of those children presenting for their EHCP. So we've had, almost 300 or about 300 per year happening, which is really, really significant in terms of both the ability and the capacity to deliver assessments on time, but also make sure that we're identifying and working with schools and other providers the right support for each of those children or young people.
Thank you.
Yes, thank you, Sal. The issue of the increasing demand for services and also the complexity of services comes up again and again in this report and indeed in each meeting. And I think this is something, that we're likely to want to come back to a little later in this agenda item. Beth?
Thank you, Chairman. May I follow on from Anne's question and say, what are you going to do about it? Because sitting in the other side in schools where we've got children waiting for EHCPs, the service is not good enough. The direction of travel is not good enough. It needs to be improved. So as officers, what's your plan to get us back to a better place?
I would suggest that actually the provision of services and the provision of assessment activity that's been going on from within SEND services has actually greatly improved, but we're really, really clear that there is still work to do. We have revisited and continually keep a monitoring eye on both the capacity and the nature of our SEND support services to make sure that we are doing everything we can to support where EHCPs are requested. We do work incredibly closely with schools, and you'll hear a bit later in this evening's agenda about the education partnership that's been developed. So we're developing that strategic partnership with schools to better understand their needs in terms of supporting children with special educational needs, as well as the needs of children and families themselves. So I think we continually keep a review on how we operate and the way in which we organise ourselves to deliver as an effective a service as we possibly can. Like I say, we have improved. That's been noted by the inspectorate, both Ofsted and CQC, that have recognised the movement forward that Wokingham has made. But at the same time, we are really, really clear that that's not the end of the journey. We still have our SEND improvement board arrangements in place so that we're continually looking at how can we improve the services that we provide for children with SEND and their families.
Thank you, Sal. Do you have a follow-up question or comment, Beth? Lucian, can we make sure that that is minuted? Yeah. Thank you.
My apologies, Chair. I didn't hear that last element.
Sorry, I'm happy to repeat it. Can we bring this back to the next meeting so that we can look at the direction of travel for the AHCPs and see if there is actually any improvement?
Of course, we can bring back further reports in terms of, in terms of the performance reporting, it is a standing item on the performance report agenda. So you will continually see where the performance is either improving or decreasing. But we can at a future point certainly bring back some further information around the development of the SEND agenda.
Thank you.
Beth, if you could turn off your microphone, please. Okay. Pauline, is this still on dashboard item 1?
Yes, but it's the same question really for all of them, and it's about the presentation. We've got the whole of the year 2020 to 21 figure, and we've got comparative data for Q4 for last year and for this one, but we don't have data for the whole of this year. I assume that what we have to do is add together quarters 1, 2, 3 and 4 and divide by 4, which for dashboard 1 at a quick calculation comes to 852, which is upwards. But could we please have the whole of the total average for the whole of the year, please, when we have these at this time of year, not just 2020 to 21, but 21 to 22, and not just for Q4, but for the whole year.
Yeah, thank you, Pauline. If you could switch off your microphone, please. Thank you. Yes, that was an example of the kind of overarching question that I was hoping we would get to in the second part of this agenda item. But I think it's a point well made, and I would like us to consider it in more detail in the second half, a discussion on this agenda item, if people are happy with that. Are there any other comments or questions at all about dashboard 1? If not, may we move on to dashboard 2? Dashboard 3. I have a question, and it's about the percentage of assessments completed within 45 days. Wokingham continues to be consistently and significantly below the England and statistical neighbour averages. What are some of the reasons for this? And are there actions in the management plan to try to address this? I do apologise, I should rephrase that, because I'm sure there will be actions in the management plan. If you could just outline what some of those key actions are. And finally, are officers aware of any strategies and tactics so far not deployed here, but that have been successful elsewhere in helping to raise the percentage of assessments completed within 45 days? Thank you.
Could I just check, Councillor Mickle, is that in relation to early help or in relation to assessments in the front door?
It's front door, Adam.
Yeah, it's the front door.
Sorry, which data set are we looking at?
Dashboard 3.
Okay.
Thank you.
So we have been, so in response to the question around the assessments in timeframes, we have been doing work on that in relation to clearing a backlog. I think there's always a challenge in relation to timeframes, often around sometimes in meeting the needs of a case. There'll be some that are late and over time. There'll be some where it's delayed because there's other activities underway that does delay the assessment being completed. But it is an area of focus and it is an area that we are picking up and looking at. There's recently been a drive in the front door in the duty triage and assessment team in terms of reducing what's known as the backlog, which is numbers of assessments that have passed a 45-day period. And what happens when we do that is it will cause a knock-on decrease in the figure of completed, because those will then be counted into the next quarter. But it is an area we are looking at, and that number has reduced significantly in terms of those that are over 45 days at present.
Could I ask what sort of scale of numbers of the backlog we're talking about?
So currently, I would say we used to average probably about 25 assessments that would sit out of timeframes, and I would look at that, and that would flux up and down in relation. Some of those would be extended, and that could be due to complications in relation to where that case sat and what else was going on at that time, whether that case was in court proceedings, whether there are other complicating factors. For example, we've had two recently where our newly arrived unaccompanied asylum-seeking children, where the assessment process takes longer in terms of completing that assessment. So for some, there will be valid reasons where it meets the child's needs or the situation. Others, there won't be such valid needs, and that's what we're trying to address in terms of ensuring that we complete those where we can within timeframes.
Thank you, Adam. Would anybody like to ask Adam any questions at all on that response? Or any further questions on dashboard 3? Anne?
So it's just the service is reviewing the number of contacts that have not progressed to assessment to ensure that thresholds are being applied consistently. I think I've asked about this before, actually, but I just wondered do staff have sort of a checklist or something like that to give them an idea of how to assess whether the contact should move to an assessment so that you can achieve consistency?
So there's what's known as a threshold document, which lists different thresholds around what should progress or not. I would also say it's not a science. It's subjective as well in relation to other factors and information, and that's what makes it so complicated. So we have gone for periods where the service manager may review some of those to establish whether that's a right decision or not in terms of cases progressing or not, or they may be referred to other agencies or through step down, what we call step down to early help at that point.
So are all contacts which don't progress to assessments, are they double checked by
They're not. I wouldn't say that they were all double checked. I would say there's an element of dip sampling. If we were double checking, that would be, I would say that wouldn't be an appropriate use of services. But there is a process where a worker makes a decision and the manager signs that off. So that's baked into normal process. So you could call that double checking, or that's baked into the process. What we do occasionally is dip sample those and review those. For example, where a case may progress to a child protection inquiry, they're also looked at about whether that's appropriate, because it's ensuring not only the ones that don't progress appropriate, but the ones that do progress appropriate, because it's about us ensuring that we're proportionate in relation to our intervention in families' lives.
Okay, thank you.
Moving on, dashboard 4.
Can we go back to dashboard?
I did ask about dashboard 2, if there are any questions, but not quite happy to do that. Okay, dashboard 2, the early help. Beth?
I'm concerned about this, that the direction of travel on 2 of the 3 measures is downward, which early help for very young children or children very new to us is so important that it might save us money and time in the long run. And this is very disappointing to me. I've been away from the authority for 4 years and I'm not sure things are as good as they were when I left. And I don't like to say that because I've only been here for a month to have a look at new figures, but my gut feeling is that things are not as good as they were and not as good as they should be. Maybe wrong.
Councillor Mickle, could I just seek clarity in relation to which one you're referring to, because a downward trend isn't necessarily a negative on this table.
Beth, can you clarify?
Yeah,
the specific
I was looking
items?
at number of referrals and average length of time. So have I read it wrong then, Adam?
So the average length of time between referral and assessment completion going down would be a positive.
Thank you, I've read it wrongly then.
Yeah.
I would say just to add in relation to early help, I think the key part on that one is the significant increase that the teams have been dealing with, and the actual timeframes have gone down, which I would say is a double positive. There's a significant increase. I think it's around 57% since the same quarter last year, but we're managing to sustain positive timeframes. And it's a trend that's noted across this area in the southeast. I was talking with colleagues across other local authorities, and they're also seeing a significant increase. So I suppose just to say, I think we're doing very well in that area, or quite well in that area, in terms of sustaining delivery with that significant increase.
That's a very valid point.
Yes. Thank you,
Adam. Particularly about the 57%, increase in referrals, and I do also appreciate that it is sometimes very difficult, to interpret some of the arrows and symbols that are used in some, but we will. We'll learn.
I think we did actually colour code them for a while, green and red, but I think that led to further confusion as well. I think sometimes it's arriving at a display that everyone, I suppose, appreciates.
Okay, moving back to dashboard 4. Any questions at all on dashboard 4? Anne?
Sorry. Workingham sets itself a best practice standard of carrying out each child protection visit within 10 working days of the previous visit. Does that mean that it actually visits every fortnight?
Sorry, the question is, do we visit 10 days as a fortnight, as 10 working days? So that's the target that we set ourselves for child protection cases.
Yes, so it says in 10 days of the previous visit. So
yes.
Does that imply that there are visits fortnightly?
Yes, that would be 10 working days. So if you look at the bottom part of the table, percentage of child protection visits within timescale, which would be the 10 days. So we've achieved 77% within 10 days. So of those 164 children that are subject to a child protection plan, 77% of those were seen every 10 days by a social worker. When you take that metric to 15 days, that percentage increases significantly again. The 77% increases significantly.
Yeah, I think what I'm just trying to ask is, does the child get 2 visits altogether, something like a fortnight apart, or does that child get a visit every fortnight in a continuously?
I don't think I'm quite clear of the question. So you undertake a visit, and then within 10 days of that visit, you will visit again?
Yes, so is it a fortnightly cycle of visiting?
Every 10 days.
It's not just 2 visits altogether to that child ever.
No. So right. If a child is subject to a child protection plan for 6 months, they will be visited every 10 days during that 6-month period.
Right.
That is the unless there are reasons that doesn't occur, that may be, as I said earlier, the child focused or because of the families away.
Right. Okay. Thank you.
Thank you, Adam. You're happy with that, Anne?
Yes, that's fine.
Thank you very much. Any other questions at all on dashboard 4? Dashboard 5, children in care. I have a question on this. I note the increasing number of unaccompanied asylum-seeking children coming into care. Do officers have any concerns relating to this, such as capacity, gaps in provision of any specialist supports that might need to be tailored to these children's particular circumstances? Any concerns at all?
So I think it's fair to say that any increase in any cohort to this level would cause a challenge, whether it was children that weren't unaccompanied asylum seekers or are unaccompanied asylum seekers. So the number, when you look at the total number of looked after children that's increased, I think it's 30 since December or quarter, I think, when you look at the last year. And that does cause, I would say, a strain, because it's a significant increase as to where they sit in the system. So some of those may sit in the looked after children's team, some of them may sit in the what we call the ABC teams, which is Ambleside, Conifers and Brambles, which are the child in need, child protection and court teams. So a number of those children will be subject to court proceedings, that increase, and half of that increase, I would say, is unaccompanied asylum seeking children. So children unaccompanied tend to come in, older children, they tend to come in 16, 17, so they have certain needs around accommodation, certain needs around languages, faith, and meeting cultural needs, and these do bring some challenges that an area such as Wokingham may not have the resources that can fully meet. Out of, I would say, a large majority of our children are unaccompanied, are placed on the periphery or out of Wokingham, and that's because that's where the resources are, where we use to place them. So a few will go into foster care and some will go into what's called supported lodgings or supported accommodation.
Are there any particular concerns? You've outlined some of the very understandable challenges, but are there any particular concerns that you have, and any things which you would perhaps suggest might be done differently, or other sources of assistance and so forth?
So if I make reference to our focus visit and our Ofsted letter that's published on the website that all could have seen, that does make reference to the emotional well-being of unaccompanied asylum-seeking children and how that's met. We are in the process, so we're in the final stages of setting up a looked after CAM service. Those who are part of the Corporate Parenting Board will be aware of that, because we've been discussing it for some time in relation to the planning with the CCG, and that should be up and running in the summer, and we feel that will go towards addressing some of those challenges around meeting those emotional needs. I think it's about how you balance in terms of meeting those, because often you can't meet those in the first sort of 3 or 4 months. It's around that therapeutic engagement and relationships that the workers may have and the placement may have at the point of arrival, rather than a direct therapeutic or clinical relationship.
Thank you for that.
Chair, just to add to that, Ofsted commented on the Herculean, quote unquote, efforts that had been undertaken by staff throughout children's services in responding to this recent very significant increase. The other point we should note also is that the virtual school has oversight also of the educational needs of unaccompanied asylum seeking children, and that's an area of focus for us also.
Yes, thank you, Helen. And I'm sure that we would all wish to also offer our thanks to the Herculean effort, of all of the officers, because we are very, very aware, of the scale of the challenge, and all of the, commendable work, that is being done ongoing. Yeah, I did pick up, though, Adam, one of the points you made about the crucial first 3 or 4 months, where it can be particularly difficult, to support children in these circumstances. But thank you for those comments. Beth.
Yes, thank you, Chairman. Could I ask for a bit of a change in the way this is reported, in the fact that the children who come in as asylum seekers and refugees against the other group of children, which are the homegrown looked after children, are split in numbers, so that we can have a clearer indication of how many of each group there are? Would that be too difficult to do?
So for some areas, we do count them differently in terms of keeping children. There's one particular metric, which is keeping children local to their community or local to where their home address. Obviously, we're taking in the young people at point of arrival, and they may be transferred to us. But I would say that of that figure of 136, 28 of those would be unaccompanied asylum-seeking children at this current point.
Would it be easy, Adam, to put that figure in brackets afterwards or something, so that we'd have an idea of the proportion?
We could do, if that's something that the overview and scrutiny would find helpful, we could record that. I'm just curious about whether what other cohorts we'd like to define in terms of groupings on there as well.
For me, it was the children coming in from abroad. So from Hong Kong, from Ukraine, any other area.
Just for clarity, when we're describing unaccompanied asylum-seeking children, that would not include children from Ukraine or children from Hong Kong, because they don't fall within that category.
Beth, and if I could just respond to Beth and then come to Graham. I was going to, given the increase in the number of unaccompanied asylum-seeking children and the probability that many of them will be in our care for a considerable period of time for the foreseeable future, I was going to make a recommendation in the second half of this agenda item that we consider reporting data selectively, on unaccompanied asylum-seeking children. So I'd like to come back to that issue, if I may, towards the end of this agenda item. Are people happy with that? Okay, Graham, and then Anne.
Yes, thank you, Chair. I just wanted to raise that we need to be careful. A lot of this information is out in the public marketplace, and when we're making selections about groupings, we must make sure that we are legal and moral in our approach.
Thank you, Graham. Anne, still on this dashboard?
Yes, it is. Yes, I just wondered, in the table of a breakdown of face-to-face visits and virtual visits, could you give an idea of what, under all visits, what the other types of visits are? Because it's a much bigger number than the face-to-face and virtual.
So just my first point of observation of that table when I was looking at earlier, I think there's a data error in the dates. It should roll over to 22 at December. I'm not sure. So it should go 21, 22. So it's looking at the year. And what this table is looking at showing is that as we've exited COVID, we've moved away from virtual visits to face-to-face visits, and that all visits is the total number, whether they were face-to-face or virtual combined.
Oh, so but for example, April 21, all visits 731, but face-to-face and virtual comes to 119 altogether. So how do you compose that figure under all visits?
Because it's children in care on the left, on the right is all visits carried out by children's social care.
Oh, right. Okay. So could you just give me a vague idea, just sort of what other types of visits those would be then, please?
So that might be a child in need visit. So a child who is, so children are generally within social care under child in need, which is a plan of support, child protection, which is a plan of support and protection, or looked after, which becomes a care plan. And then you also have care leavers who have pathway plans. So there's those four categories. Now, I don't believe that covers care leavers. I would have thought that number is all visits for children, which would be children in need, child protection and looked after. So during the depths of COVID, we moved to a position where we enabled some visits for some families where either the child or member of the family, looking back, it feels a long time ago, but where we couldn't undertake visits and some visits were done virtually. We sustained a high level of face-to-face visits throughout COVID. And what this shows is that, I suppose, as they've reduced over time to practically nil.
Okay, so it sounds as if perhaps the majority of those all visits are to children in need, perhaps then.
I would say children in need, child subject to child protection plans, and looked after, if it says all visits carried out by CSC at the top.
Right, okay, thank you.
Because that's per month, those visits. So I think looking at the numbers above, just back of an envelope, I think there's 165 CP, 130 or 106 looked after, and then there's probably another 200 and something children in need. And when you combine those together and the frequency of those visits, you'll start getting those sort of numbers per month. So it shows you what that table shows when you look at all visits is the amount of activity that is taking place, because every one of those involves a social worker going out, seeing a child, direct work of a child, implementing a plan, returning back and making a recording of that visit. And that shows the level of activity that's undertaken.
And actually, so are you suggesting that those figures under all visits, they actually probably are mainly face-to-face?
They would, as we're looking down the table where you can see virtual is 0 in March, all those visits were face-to-face. If you look up at February, it says 2.7, so 2.7 of those 821 would have been virtual.
Right, I see. Right.
So it's showing a reduction in virtual and moving to total face-to-face, which is where we were pre-pandemic and where we sustained most of pandemic, because even if you look at April 21, virtual was only 6.7% of all visits.
Right, okay, thanks very much. I'm a bit clearer now, thank you.
Okay, thank you, Anne and Adam. Any other questions at all on dashboard 5?
Yes, please.
Pauline, sorry.
Looking at the first of those dashboards, children in care, is the percentage for 21 to 22 higher than the 2021 percentage? And if that is the case, why is the arrow going up? Because a going up arrow implies an improved performance.
Sorry, if you're an upward arrow doesn't necessarily imply an improvement. It implies an increase in number, and I think that's whether it's a negative or a positive, because a downward arrow might reduce to decrease in timeframes, which is a positive. So that if we're talking the top table, that's a number of children who are looked after. So the total for 2021 snapshot end of year fig was 106, whereas at the end of Q4 we're showing 136. So it's showing an increase. So it's not giving any weight to that, whether that's a positive or negative. It may be a positive for those children. It may be a negative for those children.
It was the last box I was referring to. Sorry, I didn't make that clear. The children who have more than one allocated social worker in 12 months. That's the one that concerns me most, actually, because it's not good for children not to have that continuity.
So I would concur with you. In relation of that being an area of concern. It's something we looked at previously, and I'm trying to recall whether that was this meeting or the Corporate Parenting Board, and we identified a significant month of increase where that was related to an ATM progressing and a social worker becoming an ATM, and then you having that automatic variational change in workers. I think this partly links to the challenges that we are experiencing and being nationally experienced in relation to recruitment of social workers and workforce, which is shown in the final table on here in relation to the increase we've had in interim social workers. It is an area
I do understand all that, Chairman, but my question was, if the performance is going down, why is the arrow going up?
Because the percentage has increased.
Performance is worse, so the arrow should be going down.
If I could interrupt here, it's the same sort of challenge that we had earlier, about interpreting the arrows. In this instance, okay, as Adam has explained, okay, the percentage of children in care who've had more than one allocated social worker in the past 12 months has risen from 22% in Q3 to 24%. That is the reason for the upward arrow. In terms of the impact, desirability, of that, whether this is an improved performance or not, that I think is a much more complicated issue, as I think Adam was trying to explain. But it does illustrate yet again, the challenges that we face, I think sometimes interpreting the presentation of these tables. Any suggestions that could be help to make this easier, I'm sure would be most welcome. Yeah.
Well, only what I said just now, Chairman, that if we could have a whole year's result alongside last year's.
Yes, actually, what I was going to say was, thinking about it, going back to that table where all visits carried out by CSC, is the right-hand side of the table. Am I right in thinking that the majority of those visits are not to children in care, but that particular dashboard is about children in care? So I think that might have helped to confuse me, you see. I just wondered if I'm right about that, would it be possible to add a note to that side of the table saying not just in care, something like that?
I think if I can just come in there, I think it does say at the top of that table, children in care on the left, and then all visits carried out by children's social care on the top of the table on the right. But it's a point noted, and I think going back to the other point about the arrows, I recall, I think, going back 3 years, 2 years of these meetings where there has been variations of this presentation in terms of arriving at one that sits and in terms of trying to convey, because data without, I suppose, understanding is just numbers, isn't it? It's about how we ensure it conveys that message, and maybe colour coding those arrows would assist in terms of whether it's a positive or negative, red or green, in terms of going up or down. But there's something we can take away.
Yeah,
Yes,
perhaps if we could
Chair.
look at...
I wonder if perhaps if we added another box onto the table to perhaps give some narrative explanation around the arrow and the direction of travel and what it means, that might, you know, even if it's just a very simple explanation, that might be helpful.
Yes, I was going to make a similar point. I think that the narrative that we already have beneath each of the dashboards is also very, very important, but it does need to be kept to the point, and brief. Okay. Any other comments at all on dashboard 5? Dashboard 6, Anne?
Oh, right. So it's not so much to do with Rory Wokingham itself, but dashboard 6 care leavers, quarter 4, 21 to 22, 34% of children are neat. Really, realistically, does that cohort look forward to a sort of being on benefits long term? Is that what will tend to happen to them?
In terms of the care leavers who are neat, there's a couple of things to note about this particular performance number is that whilst it is an increase in terms of the percentages, the narrative shows it's a rise of two young people. It's also a snapshot of those care leavers that are in touch. And actually, one of the critical factors is the data in the box above that says care leavers that are in touch, 99%. The more care leavers that are in touch with us, and therefore we understand their EAT situation, enables us to better target our support to those that are neat because we know of them. So in terms of that, it enables our NEAT prevention service and other services to provide additional support to those young people when we've identified that they're not in employment, education or training. So hopefully it's not a position whereby those young people are destined to live on benefits. Actually, we want to put that support to get to reduce that figure once we know it.
Can I also add that just taking into account the 2017 legislation change where the offer to care leavers progressed past 21 to 25, and that offer was aimed at those who required additional support. So you have an increased cohort who may be requesting a further service because it may be in relation to their NEAT situation, which we're then providing support with. And also in that cohort, we'll have some people that may have difficulties or mental health difficulties, or in terms of being parents who may not be available to work as well. So it's a mixed picture, and I would say that the figure looking at the national picture is, and I don't want to say about not accepting best aspirations, but it's good compared to other areas, but it is always an area that we would want to do better at, because we wouldn't want to plan for a life on benefits for any of our care leavers, because we want the best for them as corporate parents in terms of their opportunities, as we would see that in terms of moving forward in their life as they leave our care.
And hopefully members will also see the improvement in this particular dashboard element in relation to previous year's performance as well. So whilst It's up on the quarter, it's actually still improved as to this point last year.
Yes, exactly. Yes, that is good, isn't it? That's hopeful. Thank you.
This might be an instance where in the narrative, if there was national data available, it might be helpful, instructive, to include that. I do also imagine that nationally and locally, numbers of care leavers who are NEET will vary from time to time due to a whole range of different factors.
If I could just add, Councillor Mickelberry, that there is at the bottom of that table, there is a national figure. I think it's 41% of care leavers that are NEET.
Okay, yep, thank you very much indeed. Yeah. Thank you. Okay, dashboard item 7. I have a question or comment, and it's the return home interviews and the reference to May 2022 Ofsted focused visit. What's some of the initial thinking on the action plan responding to this area of in need on improvement, and can members be circulated of copies of this when it's produced, possibly even a draft for information and comment?
So firstly, I would say, so not wanting to challenge Ofsted in terms of their perspective, but to put it into context in relation to the point they raised, it was for children that arrived at that figure that they arrived at. I think they said a third in there in terms of offered of return home interviews, and we have looked at those in depth in relation to, and I would say what we've sort of been discussing really is the whether or not they were actually missing or not, in terms of some of them were 15 minutes late in terms of returning. So that picture it's the police determination whether a child is missing when they're contacted or informed of a child being absent in terms of their status. It is an area that we are looking at, and it is on our plan of work schedule in relation to responding to that, about having that plan in place about how we work with our carers, our provisions and placements, about ensuring that we're reporting the right children missing, as would any parent, reasonable parent of a child, in relation to if their child was late and what they may do in terms of whether they were reported missing or not, and looking at the expectations that we place on them and whether they're proportionate. So it is an area we are looking at. It's an area that myself and Rachel are sort of leading on in relation to the missing. But I do feel that it's unfortunate that within the letter, because I feel that when we actually looked at the number and looked at those children, I would say that whilst it's concerning that how it was read, I would say when we looked at those, it did not present us with a concerning picture about risks for those 4 children.
Thank you for those insights, Adam. I'm still wondering whether members would like to be able to view some of your suggestions in the action plan, or ideas for the action plan on this particular issue, bearing in mind what you have just said, about, with the caveat, about Ofsted's interpretation, of this issue.
Could I also just, Councillor Mickelberry, I recall from Corporate Parenting Board that this was an area that was picked up as well in terms of wanting more information. So I'm just trying to, I suppose, focus. So I'm not trying to prevent a copy of a plan, but I'm trying to feel about where that's being sort of observed or overseen. And obviously they have different roles and functions, these meetings, but it was an area that I believe yourself and your colleagues on Corporate Parenting Board we did discuss, I recall, in that meeting.
My own view would be that if it is to go to, if this is to be considered by the Corporate Parenting Board, I would be very happy with that, but I would still suggest that that members of the Overview and Scrutiny Committee also be copied into that documentation. Would that be possible?
Yeah, I don't see that as a challenge.
And would other members be happy with that? Thank you.
Okay. The number of children not currently on a school roll has decreased in this quarter and is in range with the same period last year. So obviously that's good. I just wondered, how does that compare to the number of children being home educated? I mean, presumably they're not the children who have registered as home educated. Is that correct?
Yes, that's correct. So These won't be those children that are electively home educated, so they will not be counted in this figure set. These are children that we are aware of that are not currently on a school roll. Those where a parent chooses to electively home educate, that's considered to be education, and therefore those children aren't required to be on a school roll.
Right. Okay. Well, it's good that you're keeping all these statistics, I must say. But, so, do you have an idea of how many children are registered as being home educated?
Yes, I do, Councillor Chadwick, but I'm afraid I haven't got those in front of me at the moment. Again, at the moment, there isn't a national requirement for us to hold the details and the numbers of children that are electively home educated. That is something that the government has issued some consultation about, and there's likely to be new guidance that comes out that will develop a register whereby we will be able to hold much more valid numbers of children that are electively home educated. At the moment, it is up to parents and schools to inform us if they are choosing to electively home educate their children.
Oh, right. So, I mean, there is an Education Act of 2016 or 17, I think, isn't there, that says that borough councils have a sort of requirement to ensure that all children are educated.
Yes, and so
we're educated.
Yes,
so presumably you've got some awareness of these children.
Yes, so we will have a general awareness, and for the vast majority, where parents are choosing to electively home educate their children, they will inform us of such, or they'll inform the school that their children are leaving, potentially to inform us. And yes, we do have a number of activities and responsibilities in respect of ensuring that all children are receiving education. We have our Education Welfare Service, works incredibly hard with the electively home educated community and with parents on providing support, but also understanding the nature of the education that those children are receiving, and we have to make judgments on whether the education of those children is educational or not. And as I say, the government and the DfE are putting in some more robust arrangements, or are consulting on more robust arrangements, in order to be clearer about the council's duties and responsibilities in this area.
Oh, right. Okay. So it sounds as if you when this register becomes a requirement, you actually do have the information already, really.
Yeah, we do have lots of information, so we can provide, and we have provided to Overview and Scrutiny before, the information that we do have in respect of the numbers of children that are electively home educated. Previously, we've had to caveat it to say that it's not a national requirement. It may be in the future that it doesn't have to have that caveat, because it will become a requirement, and we may have to track or register, not track, sorry, register all those children that are being electively home educated.
Is there a disadvantage to, giving us the number?
No. None whatsoever, other than I just don't have it in front of me at this precise moment in time. Councillor Chadwick, I'm more than happy to share that outside of the meeting.
Perhaps I could go into the minutes as Councillor Mickleborough was suggesting, follow-ups.
Yeah, absolutely. Absolutely.
Thank you. And in light of this discussion, and also the changes in legislation around this issue of elective home education, I'm wondering whether, when we come to discuss the work programme, whether this might be something that we might wish to consider scheduling into that work programme. But if people are happy for the moment, I'd like to leave that issue for the time being. Are there any other questions or comments at all about Dashboard 7? Okay. Now, I did suggest that at the beginning of this agenda item that I'd like to leave us time to consider some general or overarching matters that are not specific to particular dashboards. And I'd like to, perhaps if I may, kick this off with discussion of with some comments, concerns about the demographic profile of our children in care. I understand that aspects of the demographic profile of children in care is changing, for instance, with increasing numbers in the older age groups. I'm just wondering if officers could share with us some of their initial thoughts on some of the implications of this, how these changes are being dealt with in the strategies and action plans. What are the implications of this going forward in terms of service quality and cost, and what opportunities might be arising out of these demographic changes?
Councillor Mickelberg, could I just, I know we moved from section 1, we didn't cut, there was table 8 as well in there, in the table of data?
I do beg your pardon, table 8.
Just because I made reference to it earlier as having a correlation or causation in relation to the changes in social workers for looked after children that one other member highlighted.
I do apologise. That's my mistake. Does anybody have any comments or questions about dashboard 8? Okay, Graham, Beth, and then Anne.
Yeah, it's just a quickie. I haven't had many questions on these dashboards because most of it's occurred under my stewardship. But I think it's worth Adam or Helen talking about the rise in turnover of staff, social worker staff, because those that have been on the committee for a long time will remember great efforts went to bring those numbers down, and they were brought down. But there are reasons why this has happened, and I'm privy to that, and I'd like the officers to have the opportunity to explain it.
I would say that the figures probably, we started a piece of work probably 2 years ago now, probably a bit longer, where we focus very much on recruitment. We have a meeting that meets regularly, recruitment and retention. We have a specific person recruited to assist with that in terms of how we campaign and how we focus on recruitment. The figure at that point, I would say, was around 33% of locums. We set ourselves a target of 10%, and that would take into account maternity, sick leave, gaps in vacancies as our target of 10% of locum social workers. We got ever so close. We got to 15%. We hovered around that, and then we started to climb, and now we're predicting to be around 28%. And I would say this is a culmination of a number of factors that includes COVID, includes what was referred to as the Great Resignation. We've had people reassessing their own work-life balance. We've had people moving to the coast. We've had people moving across the country. We've had people relocating. We've had I would say that number would be significantly higher if we didn't have a successful drive, which we have had, and we're currently recruiting. We're sort of rolling out every summer at the moment 8 newly qualified social workers. So we have a scheme which is assisted year in social work practice, which is the ASYE. So they're newly qualified social workers. They come in with us for a year. And we've increased that. We used to recruit 3 a year. We went up to about 5 or 6 a year. And now we're aiming to recruit 10 a year. And 2 of those proposed to be supernumerary above numbers, with the idea being that we grow our own and we fill those vacancies that we create. So we reduce the number of locums. And it's not being negative against locums or interims, because they fill a valid need. They provide consistency. We have had great stability. We're also part of what's called the MOC, which is a memorandum of cooperation across the southeast of all the local authorities. I think it's 19 local authorities. And the idea is to prevent permanent workers leaving permanent roles and becoming a locum. So theoretically, if a social worker who's working in Surrey left a permanent job, they could not become a locum for us. And that's to try and prevent people creating a transient workforce, because sometimes we're dealing with some of the temptations and challenges that agencies create in terms of, for their, I would say, in terms of workers leaving permanent roles and becoming locums. So we've got a range that MOC has just been re-signed off in April, adopted by local authorities, and we discuss and meet that with the ADs across the South East, as well as Helen does with the directors, in terms of looking at that and ensuring that people are signed up to it. There's also a board that looks at exemptions where some local authorities may approach it and say we're in real trouble, we have to go above the pay cap of locums, and that's and that's agreed in that forum. So there's lots of different work streams where we're trying to address it. I would say it's a national challenge. You would have seen in some of the recent high-profile reviews in the press that some authorities have a much higher number of interim and locum staff. We're very conscious about that, and we're very much focused on creating Woking as being a destination where people want to come and work, be permanent, stay, and develop their career. So we have a very good training offer to support that.
Thank you, Beth.
Thank you, Chairman. If I may comment on that, and well done for that, because having a few social workers as friends, I know how quickly they get to burn out, that they get to want to be a barmaid and not a social worker because the pressure's slightly less from the drunk than the children. And so I admire the way that you've done that, and long may it last. I think we need to keep an eye on it. We need to keep working together with other authorities. But we need to be mindful that those social workers, excuse me, are very precious to us, and treat them and all our other staff, including you, well, so that we retain the services of good people and not people who are moving around for money. So well done. Thank you for that.
We just to add to that, we very much see our workers as our commodity, and I think our approach is that we're only as good as our frontline workers, because we can have all the great strategies we want and the expectations, but if we haven't got the quality to deliver it, we get nowhere. One of the, I would say, the key bits we did a couple of years ago was when we looked on our staffing numbers, was we got to a position where we were able to grow our FTE to reduce the caseload, because it's around having people having proportionate caseloads to enable them to do the work for the reasons they came into this work to do with children. That's direct work with children. So that's a real, I suppose, a key, I suppose, pillar of our offer really is that training and manageable caseloads.
Thank you, Beth and Adam. Anne, you had your hand up.
No, it's been asked for.
Thank you. Al?
Oh, sorry.
Yes, I mean, this sounds like you're operating some sort of cartel, stopping people becoming self-employed. You know, I mean, it's you know, you're abusing your position in the marketplace by stopping people who just refusing them a job simply because they work for the neighbouring local authority.
Well, it's an approach we've adopted, whether that's a cartel, it's an approach we've adopted across the South East. It's also one in London, there's one in East Anglia, and it's most parts of the United Kingdom. That those workers are free to apply their, I suppose, their self-employed status or their umbrella company or their shareholding limited employee status, but outside of the South East region.
Any further comment, Al?
No, okay, thank you.
Thank you. Any other comments at all about Dashboard 8? Okay, then if we could perhaps return to some of these general overarching matters. I think I'd probably need to sort of restate the first of these. It's about the demographic profile of our children in care, which I understand is changing. For instance, an increase in the number of children in the older age groups. Just some thoughts about some of the implications of this, how these are being dealt with in the strategies and action plans, perhaps with just, if possible, one or two specific examples, illustrative examples, some of the implications potentially in terms of service quality and cost, and also any comments about opportunities that may arise out of this changing demographic profile.
I think the obviously the conversations earlier were indicating we'd have a significant increase in unaccompanied asylum-seeking children. We've also had an increase, I would say, in the or a variation in the age range. In 30%, I believe it's 30% of our 16 of our looked after children are 16 and 17-year-olds. 20% of our looked after children are unaccompanied asylum-seeking children. So these are significant numbers. And really, we've been focusing very much recently on that cohort, the 16, 17-year-olds, and very much looking at transitions into adulthood and their care needs and environment needs in terms of where they'll live. So we meet regularly with housing. We're working with housing in relation to developing that offer, and partly London Road, for those who are aware of it, was part of that planning as well. We're now doing work on sort of horizon scanning backwards and forwards, and that information is going towards the strategy that housing are developing in relation to housing needs of young people. So it's area that I suppose that those strategies that we're looking at is around those accommodation needs of those young people as they transition into adulthood and leave our care.
That's very helpful and reassuring, Adam. Does anybody else have any further comments on that specific issue?
No, only to say, Chair, that I would support that, because if we can quickly assess, and speed is of the essence, and that is difficult with the structures that are in place, but it enables targeted care to happen. But I know that the officers are aware of that, and it is worthy of our discussion too.
Yes, thank you, Graham. And I was reassured, as I said, by the specific examples that were cited, the focus on transition to adulthood, working with housing, ensuring that housing support will be provided and so forth. So thank you very much indeed for that. I would, if I may, ask a very similar question, but this time with reference to the increasing numbers of children in care. This was a matter that was raised earlier in our meeting, but also to the increasing complexity of cases, which keeps being reported again and again. So it's the similar questions to the matter that we've just discussed, implications of this. One or two illustrative examples, of how these are being dealt with in strategies and action plans. Implications and opportunities that this might bring.
So I think if I understood the question right, it's in relation to the general cohort growing and the response to that. So as I mentioned earlier around the case numbers that we have, a target caseworker, that did allow some flexibility in terms of those numbers increasing and decreasing, gives flex in the system. We have put in place a new worker or a new post or role within the Here For You team to take on, and that's in response to the increase in the unaccompanied asylum-seeking children, acknowledging that's a significant increase in terms of which will rest and sit. Those children will sit in that team as they progress to become care leavers as well. So we have flexed and adapted. The team have also, and this isn't just a new response, but they've also recently involved in the various activities and celebrations with our children. There was a recent Eid celebration. I've seen some footage and photos of that took place at Here For You, and there was also recently a football tournament that I believe some councillors attended from the Corporate Parenting Board and engaged with a number of young people. So there are opportunities, I suppose, in terms of that way around varying and increasing our offer of that engagement and that enrichment that we offer, but we do flex and grow as numbers increase, and it's about keeping an eye on that, so we're trying to stay on top or ahead of the curve rather than chasing the curve in terms of as those numbers increase, because it comes back to creating an environment where social workers are able to do their job do it well and are supported by the organisation and local authority.
Yes, thank you for that. Could you comment on implications of the increasing complexity of a lot of the cases that are presenting?
I think that's difficult really to respond to. Maybe about, I suppose, a bit more clarity about what is meant by that. I would say when we talk about complexity, I suppose we think about overlaying multiple challenges in terms of situations. I think the COVID and the increased pressures and the recent that we're all probably experiencing in terms of cost of living is adding increased pressures. But I would say that lots of cases there's complex and complexity, and I would say it's those layering factors or challenges that are the families are experiencing.
Chair, just to give Adam a break and to come in on one additional point. We know that the mental health needs of children and young people are increasing in complexity, and we know that not just ourselves but other local authorities, neighbouring local authorities are also challenged by particular cases. You did reference opportunity. There is an opportunity that is open to us to potentially make an application for DFE capital funding for some provision that might meet needs of very complex children and young people. We've just become aware of this, and it may be an opportunity for us to explore with the CCG, for example, and or potentially other neighbouring local authorities to see whether a joint bid would be a very useful thing. Now, this would be capital only, so we would have to find the revenue if we were to be successful in this competitive bidding round.
Thank you very much, Helen. Does anybody else have any questions at all on that specific issue? Are there any other general or overarching questions? Because I've got two others I'd like to raise, if I may, but I'm very aware that I don't want to be hogging. Okay, thank you. This evening there has been a little bit of there have been some challenges, in interpreting the dashboards and the narratives, but on the whole, I think that they seem to be effective. But I do propose that we continue to review the categories of data reported, as we were suggesting earlier, and I'd like to put a particular proposal or for discussion, raise something for discussion. For instance, given the growth in numbers of unaccompanied asylum-seeking children, I'd like to suggest that we consider requesting some data on this particular cohort for the foreseeable future. Okay, and similarly, I'm just wondering whether there's any potential for reporting of some data on the emotional health and well-being of our children. Could I throw this open to discussion amongst the members first and then the officer's response? Beth?
Yes, thank you, Andrew. I think that's a very good suggestion. Spending time in school is very clear to me that our young people are experiencing the emotional challenges that we never imagined when we were children. They've got much more emotional needs, and I think the internet and Twitter and all those things that are beyond my understanding contribute a great deal to the emotional insecurity that they feel. And so I think it would be very useful for us to monitor that, at least for a time, to see if it helped us in doing the job that we can. And hopefully you'll be able to train us in interpreting those figures. I clearly read that wrongly tonight. Lack of practice, wrong specs, I don't know, tired brain, all of those things. But I think we need help from you as well about interpreting all the information that you're giving to us, especially those of us that are new to this committee. And while, Adam, yes, I am on corporate parenting, this is a different type of information, and it would be very useful to have some how to read this chart, even if it's red, amber and green, alongside it. That's very simplistic for my ancient brain, shall we say. Thank you.
Thank you, Beth. Anyone else on this particular issue? Graham?
Yeah, can I just take 2 points? One is with the unaccompanied children. Again, using having had 2 years as deputy and the last year as lead, I've been very aware of the pressures on the officers and the department as a whole. And with the unaccompanied asylum seekers, like a lot of things in children's services, we only get to see the tip of the iceberg. And there's a lot of stuff that goes on underneath. And so I do support completely having that as a separate agenda item without it taxing the officers too much in bringing the reports forward, of course, because there are different implications outside of those that we would observe through our residents and through our homes. So I support that completely. The other side of it is, and I'm back to the tip of the iceberg, you know, children's services is probably the most complex portfolio. And I thought about it very hard before I took it on last May. And there is a tremendous amount of depth and complexity. There's relationships with the health sector and many others. And those of us, and Andrew has been around on this committee for a long time and has borne witness to that. So when the training comes up, my request to the officers is that it's not just about what does children's scrutiny need to do, but education in the structure and the process that we have. And it's clear, excuse me for saying so, but I have an advantage because I've had a year in situ in seeing some of the questions, and, you know, I'm not making any accusations. I went through the same process myself, but it would be worth all of us investing in that with the officers to also make these meetings more productive and get to better outcomes and impacts that we desire as a group.
We will get the officer's response to those comments in a moment. Pauline?
Yeah, I fully endorse what Graham's just said, because as one of his predecessors as the exec member for Children's Services, he's absolutely right. There's a huge amount of very, very complex work that goes on that does take a bit of understanding. And 3 or 4 years ago, maybe even before that, the training that the Scrutiny Committee had was about how the department functions, what the different sections are within it, what they do, how they interrelate with each other, and that sort of thing. It wasn't just about how we scrutinise it, it was about how the department itself actually functions and works. And it would be really useful to bring that back. We used to do it half an hour perhaps, at the beginning of the first children's scrutiny meeting, just to make sure everybody actually understands how the department works and some of the complexities it deals with.
Thank you for that, those comments, Pauline. There was training, of course, originally scheduled immediately prior to this meeting. It's now been rescheduled to later in the month. Could officers please, when organising that training, take on board Pauline and Graham's observations about the importance of us also being trained in understanding how the department works and the complexity, you know, of the matters that you deal with. So thank you very much indeed, you know, for those comments. Okay, Adam or Helen, would you like to respond to any of the comments that have been made in relation to this?
Yes, if we could, Chair. In terms of the separate data on unaccompanied asylum-seeking children, given that those young people could be easily identifiable, the suggestion would be that we put that into part 2, the confidential part of the meeting, because, you know, that it's a small cohort of young people. So I think we've got to be very sensitive about that data. But we welcome the opportunity to scrutinise and challenge this in more detail.
And I was just going to add that the training, we recently done it for the Corporate Parenting Board in relation to looked after children, and I think it's a lot to pack into an hour because it is very complicated. And I think the point I would make is that children's services is a very delicate ecosystem, and you almost need to understand how each part links on and impacts others. We did do training, I think it was last year, myself and Carol delivered a training trying to give a sort of journey through the system, really to provide an understanding of how all the different teams and different sort of language we use, how they all link together in terms of what a child's journey through that system may look like. And I believe that's scheduled for later in the month.
Yes, just to build on what Adam has said, it may be we need to have more than one session, given the complexity and the challenge that you know it is, as has been said, a very complex area of council business. And I think we also need to do justice to the educational system as well within this. So we'll take responses from the committee around the appropriateness of doing more than one session or otherwise.
Thank you very much, Helen and Adam. I can see many people nodding in agreement, with what you have said. I do remember, the journey through the system training that Adam and Carol gave last year, I think, and it was very, very useful indeed. But perhaps after that training, we can reach a consensus on whether additional sessions might be required, and fully take on board the point that Graham originally raised about the very sensitive nature of the data with regards to unaccompanied asylum-seeking children, the need for that to be a Part 2 item. Well, moving on, agenda item 9, the education update. Again, all members have had the report and so do not need a detailed introduction or overview by officers. Although if, of course, there is, anything by way of introduction that officers would like to present, please do so.
If I may, Chair, given with the theme of this evening, just to suggest this is a rather large and complex area in terms of the education environment, some of the significant changes that are happening pretty much as we speak, and some of the implications for our education services. What this report hopefully does for members of this committee is give a bit of a sense of some of the areas of practice or the areas of performance generally in relation to our education environment, and actually the positivity of such, but also hopefully gives some confidence that actually we don't rest on our laurels and that we are continually attuned to the meeting the needs and the outcomes for children and young people through our education system. So particularly in this particular report, thinking around children and young people's attendance and their ongoing attendance, the development or the ongoing development of our strategic partnership work with the whole of the school sector within the borough. So all of our schools and settings. It gives some information or a bit of update on some of the things that are happening in terms of the national picture, in terms of the white paper and the green paper, and therefore what are some of the implications for us in the education part of children's services. And finally, it gives some additional update in terms of some of the reorganisation work that we're undertaking within learning and achievement and partnerships in order to respond to those strategic demands. So rather than go through the report in full, I'd like to leave the overview there, but I'm happy to take any questions or queries.
Thank you, Sal. The report I found to be extremely useful indeed, and thank you very, very much. It is a different format, I think, to those that we've had before, and I felt, that it worked well. It has been very helpfully divided up into numbered sections. So what I would propose, if members are in agreement, is that we take any questions or comments, firstly, with respect to section 1. Anne?
It's sort of probably trivial. As regards current performance of working in schools, all pupils, so 93% attending on the 26th, I suppose that's the week beginning or ending the 26th of May. Presumably children who are off sick with a sick note or have COVID, they don't count as not attending.
As we were going through the pandemic, the DfE adjusted their coding system to allow us to understand the numbers of those children that were not attending due to COVID related reasons, but that not necessarily been linked to non-attendance. However, that no longer exists at the moment, and it's really important to understand that, because it would be different in terms of what was there earlier in the year. So that 93% is the attendance of all pupils on school rolls.
Oh, right. So 7% could be genuinely sick.
Could be genuinely sick, but it could also be, as we discussed earlier, those children that are missing education.
Yeah. So, oh, that's interesting, isn't it? So you really need to know the difference, don't you?
Well, I think what that provides for us is an understanding that actually, I mean, we will understand that difference, because we will know how many children are absent due to sickness, because there are school codings that tell us that. And as you saw in the performance report, we understand and we know how many children are defined as missing education, those CME. So we will know the finite numbers. That again, as I was saying earlier, helps us to really target either our support to schools in terms of improving attendance, or support to families where it's not illness related.
But the schools provide you with sufficient information so that you do know which children are the ones who are not attending and are not sick.
Yes.
That's okay, thank you. And then the other, in section 1.2, the title is New Statutory Duties for the Local Authority, but then it immediately says that the DfE has published new non-statutory guidance.
Yes. So, sorry, carry on.
Well, yes, it's just. So, am I right in thinking that it's non-statutory guidance that you're introducing?
Yes, it's non-statutory guidance that we have to follow. It's a quirk of the law and statute in terms of we get guidance that's considered to be non-statutory guidance, but we are required to implement that guidance.
I see. Okay. Thank you. Yes, I see. Thank you. That's it.
Thank you, Anne. Beth?
Yes, thank you, Chairman. One of the problems that we have in school is that some overseas families haven't seen their own families for a couple of years because of COVID, and they are taking extended holidays because it's cheaper to pay a fine than increased airfare in school holidays. Have you any idea how many fines have been issued to Wokingham schools because of this issue? And I say that with a very guilty hat on, because my daughter, who lives in Reading, took 2 children out of school to go to Disney, which wasn't exactly extended family, but it cost her, I think, 60 quid and a fine, and saved her £2,000 in airfares. And she didn't get my approval, of course, but that didn't matter to her. She did it anyway.
So we do hold the data on fixed penalty notices. On school attendance. We have a process whereby we work with schools to look at what support has already been put in place to avoid attendance issues and to avoid the issue of fixed penalty notices. Unfortunately, given that the levels of fines are set nationally and the process for fixed penalty notices is set, some families and parents will choose that actually that's a more cost effective for them than it is to take those longer holidays in school periods when the cost of holidays are higher. We do work with head teachers around such issues, and we advise all of our head teachers to be really, really clear with their school community about attendance being paramount and that such things should really not be tolerated because it can impact so much on a child's learning and the ongoing outcomes for them.
Thank you, Sal. Pauline?
Thank you. I must say I'm very sceptical about this law, based on 32 years in education, because it's aiming at the wrong people. The people it was originally aimed to held culpable were the parents of the children who have a lot of intermittent absence, those that never go in on a Monday morning or don't go in because they don't like PE, perhaps just once a week. And I remember very, very clearly one experience when I phoned up a parent and said, Maria's not in school today, is she not well? Because this was an intermittent absentee. And the mother said, oh, I don't know. I'll just go up to her bedroom and check whether she's still in bed. She didn't even know that her daughter hadn't gone to school, and presumably she'd have gone out to work and the daughter would have stayed home all day. Those are the sort of parents the law was originally aimed at. And in my experience, the parents that take their children out of school for a week or two or for a holiday are generally the parents of children who otherwise have 100% attendance. And it's getting at the wrong parents and getting at the wrong children, and it's not achieving anything that it was intended to. And I would be perfectly happy if our department abandoned the whole action.
Thank you for those observations, Pauline. I'm not sure whether the last suggestion is actually something which is an option, but I do make an observation, that of course we do have a school attendance support team. We also have early help support team. And so my question would be, will these changes in statutory duties, will they have any resource implications for teams such as those?
It's very likely that there will be resource implications for the school attendance services. As part of the statutory guidance, the non-statutory guidance, it sets out a number of expectations in terms of how the local authority is to deliver against the new responsibilities and new duties, and the type of engagement that it expects us to have with schools, and at our current capacity within the school and our current model of engagement with schools would not meet that capacity. So we are exploring at the moment our approach and our response to meeting that capacity challenge that this is going to provide for us.
Thank you, Sal. And perhaps if early help could be included in that discussion as well. Any other comments at all about section 1? If not, section 2, the Borough Education Partnership. Pauline?
Just a very quick comment on the new Borough Education Partnership. This is absolutely a great idea, and I just wanted publicly to give all credit to those whose idea it was and those who were involved in helping to set it up. I'm particularly pleased that they're setting up a working group to look at enough secondary and primary school places, and I hope that they will not only look at the number of places but do their best to make sure that children don't have to travel very far from home as far as possible. I know that's not always possible, but I think it's a great step forward, this group, and their work is absolutely key.
Thank you, Pauline. Graham?
Thank you. I didn't pay Pauline any money, but this was put together under Helen and I together. I'd just like to give some context to people, because in the council chamber, we're not allowed to talk freely. We've got 2 minutes. And if I may, Chair, if you can indulge me for a little more than 2 minutes, maybe 3. Because when academies came about, schools that got academised went, yeehaw, we're free from the local authority. And as more and more schools academised, the local authority really abdicated its responsibility towards those schools because they were financially independent. The only place where schools and the local authorities are joined at the hip until the new statutory obligations is in admissions and send. You know, there is an argument that says actually we have no interest in schools improvement because that's measured by Ofsted. No, that's a ridiculous thing because actually when we look at the children, they don't belong to the school. They don't belong to us. They're our children. And I started before COVID came in and then followed up as soon as I could get out to see heads again. And I found that actually there was no way for we as councillors, and I mean all of us, I'm not being party here, to get information to what happens. It came through local councillors, through ward councillors. It was bitty. Of course, what you tend to hear generally as councillors is things that are going wrong and not necessarily things that should be celebrated. And as I went around the schools, I found that they know what's going on with the children. They know what's going on in the Ministry of Education. They know what's happening in their communities. And they're the ones that control the budget for the education of our children together. And I also found that it was a complete myth that schools were any more competitive today between each other than they ever were. Of course they wanted to be the best school. When they were all maintained schools, they still do. Yes, there is some difference in the way that the budgetary things work, but they wanted to work together to get best practice, to share resource as and when it came. And so when we formed the BEP, and I was very specific, it was the Borough Education Partnership, not Wokingham Education Partnership, because it's all of the borough. They are the future powerhouse for this group and for the education part of children's services, because it is they that understand what the needs are at the point of delivery. It is they that will bring ideas and have discussion at the BEP, and that will then formulate strategy. The idea is not unique. In business, we use advisory boards. It's exactly the same concept as that. And so this initiative, and I remember Andrew asking, could we have copies of the minutes from the BEP, which wasn't actually quite appropriate because I don't think it would give this group what it needs. But this reporting, I thank the officers for what they have done here because it's much clearer than I would have dreamed up. So I wanted you to get the benefit of the logic of putting this together and the substance of what we hope it will produce. So our relationship through the officers and through this report will get stronger and stronger with the BEP because they will tell us what we need.
Maureen?
Yeah, thank you, Chair. I'd just like to ask, if I may, having read through the BEP and been impressed with it, what provision is there for encouraging governors to have a representation on that as well? Because that is something we discussed briefly earlier on.
I set it up deliberately to have the heads, the Primary Schools Federation and the Secondary Schools Federation elected members. The lead members, so now Prue is on it, and of course Sal and Helen, and it is for them and for that cohort. It is not for the governors. The governors have different reporting, but the heads will report when necessary where they're getting direction from the governors. That has already happened, for example, in discussions with one secondary school and gotten us involved in, well, it's about Forest going co-ed, okay, for example. So it's about the heads. They are the gateways. and it's those people that are wanted to bring together. We thought about governors and other people. It then starts getting unfocused and unwieldy. So it was the heads.
Maura, do you want to come back on that point at all?
Just from personal experience, going back an awfully long time, which is probably irrelevant now, there's a slight caveat, if I can say this ever so tactfully, that not all heads are perhaps on the same page. But then you'll have come across that. So
If
the beauty is that the heads are in their positions because they've gone through a career path in order to get to what are now actually quite significantly well-paid jobs. And they are very different, and they do have differences with each other. And that's great, because from that, we end up with consensus and policy.
And if I may, members, we do also have regular chairs briefings, and so many of the same strategic issues that we discuss within the BEP, governors will be made aware of and have an understanding of what the business of the BEP is delivering, both, as I say, through the governor's briefings, but for those schools where the relationship between chairs and head teachers is such, those head teachers will also be informing them of what's happening within the BEP.
Thank you, Sal. I'd like to just offer some thanks before just asking one further question about the BEP. Firstly, thank you, Pauline, for expressing your support for the success of the BEP. Since its inception, I'm sure that we would also, having read through this report and listened tonight, would also not simply wish to echo those sentiments, but I'm just wondering whether there is some way of this being minuted and conveyed formally to the BEP to show that we are taking a keen interest and expressing a desire, to support the BEP. Thank you, Graham, also for helping us to understand a little bit better the context, the history of the BEP. That was very useful indeed, so thank you. And thank you to the officers who produced this report. I agree with you, Graham. It's a much better way of communicating than simply looking at minutes or a summary of minutes. So thank you there. I do have one question though, and that is there's references to the fair access policy and protocol. I'm just wondering if perhaps Sal, if you could outline its purpose and how often this has been used since it was established, and what has been the response of the school. And to complicate it further, what's likely to happen to the demand for the fair access policy in the future?
So the fair access protocol exists to support the placement of children into school places where they have either left a previous school or have moved into the area, and therefore we need to place mid-term or mid-year. Schools are signed up to it and are very supportive of the fair access policy, and again that's a testament to the work that took place within the BEP in terms of their engagement and involvement in development of the fair access policy. The FAP itself has met I think at least twice since the protocol has been put in place, and I think we've been able to place up to about 40 pupils as a result of that. So it's actually quite a busy panel, and at the moment we do schedule the meetings, start to schedule those meetings fortnightly. So it's a really worthwhile addition into the whole education environment, because Wokingham operated for quite some time without an effective fair access process.
Yes, thank you very much indeed for that, and it does certainly seem to be a very useful and well used initiative. Does anybody have any other comments at all about section 2? Section 3, restructuring learning, achievement and partnerships, with a recommendation on page 36 that this service area is to be renamed simply education. That's not our recommendation. It's the department's recommendation. Could I ask a question? I think we've read about some of the aims of the nature of the restructuring and the aims of this, and I think it's implicit, some in the report what some of the potential challenges are going to be in achieving this. My questions, I've got 2 questions, I think, 3 questions, if I may. Firstly, when is this likely to go to, and I'm assuming that it will need to go to the executive, and if so, when is it likely to go to the executive? And is there an opportunity for overview, children's services overview and scrutiny, besides tonight, to have some input and to make recommendations on this? If we could deal with that issue first.
I think in terms of, and I'll also look to Helen here just to be sure, in terms of the restructure and reorganisation, in terms of the leadership team, what we're seeking to do in terms of that is not necessarily downsize the areas of service or the areas of service responsibility, but make sure that we've got a much more effective leadership structure. Currently, as I explained at the start of the meeting, I've got a fairly broad suite of services within what is learning, achievement and partnerships. And what that does is it means that as a strategic leader, I've been pulled quite a lot across 9 individual reports, multiple service areas, and therefore it's limited my capacity, or our capacity, to really engage in the kind of strategic thinking and the strategic discussions that need to take place in terms of making sure we've got the best education system for our children and young people that we want. So what this is trying to do is rationalise some of that leadership function without loss of service delivery. As such, it's an operational change in terms of the structure. So I'm not necessarily sure that as an operational change it requires that executive approval, but of course we are bringing it here, we are sharing it elsewhere, so that our members and our executive are very, very well aware of what it is we're intending and seeking to do. So we do want to be open and transparent, and absolutely we would, if colleagues do have comments or suggestions that they would wish to feed in, absolutely more than happy to listen to those and see how we might incorporate some of that commentary and suggestion. It is a 2-part reorganisation. We're currently about to commence in terms of that phase 1, which is that leadership frame. And then as I go forward and thinking about some of the strategic challenges we've got, what's coming through in terms of the national policy, is then thinking about our phase 2, which is our services, and making sure that we can look to how do we integrate those services better, so that again, collaboratively across LAP or education, as we hope it will soon be called, we can really respond in delivery terms rather than deliver as individual isolated service areas.
Thank you. And Helen?
Yes, thank you. And I fully support everything that Sal has just said. This is about having a coherent, sustainable and fit for purpose structure that would meet the requirements of the recent education white paper and green paper. We have worked with the BEP around this, so school leaders are very much aware that this piece of work is underway. We thought it was very appropriate to bring this into scrutiny tonight, to be absolutely upfront about the work that is currently underway. Thank you.
Thank you, Graham.
No, just to say that obviously I was aware of the changes that were going to be made that have been discussed for some time. I did do an informal handover to Prue, and I think we're in total accord with the direction for efficiency and effectiveness which has been outlined.
Thank you, Graham. Anne?
Yes, I think it sounds like a good idea, and I do like the use of the name education instead of lab. I think that's great. I notice you're talking about fit-for-purpose IT systems that facilitate the delivery of core education functions. I just wondered if you could maybe give a bit of an idea what sort of problems you're having with the IT.
As we discussed a little bit earlier about registration of children that are electively home educated, because we've not had a statutory requirement to do such, our system at the moment is not the most technologically advanced. Similarly, for example, our ability to understand managed moves, so that's where schools might move children between schools. Similar but not the same as the FAP process, and there will be under some of these new duties and requirements a responsibility for the local authority to also understand and monitor those numbers, and at the moment we don't have that responsibility, and therefore we don't have the system in place in which enables us to do it. So it's an investment in those sorts of systems that will enable hopefully our enhanced school attendance system, our school admissions arrangements, to have a much better both case management system and real-time information system in terms of data collation, data gathering, that then informs our development of activity across the area.
Oh, that sounds very good. So you're certainly talking about software being used within the local authority.
Yes.
Yes. So okay. Thanks very much. That sounds good. Thank you.
Just a follow-up question on Anne's question. It's about IT services and how reliant or not is Children's Services on WBC IT services. And I guess a related issue, to that is that would there be any proposals, in this phase 1 strategy that would require changes in any other departments of the council?
I think that one of the things in terms of the white paper and the green paper is that it will impact in other areas of the council. IT infrastructure is one of those key areas, so that whole commissioning and procurement element is going to be incredibly important going forward, in terms of making sure that we've got the right tools and systems to support this activity. Again, that greater understanding of data and intelligence around our communities to inform the changing needs within the education environment. So that whole work with our place planning colleagues as well, it's going to be incredibly important. So I don't think this is just an education issue. I think this is education plus in terms of other areas of the council that impact on our communities.
Thank you for that, Sol, and that's something we're going to need to make sure is well and truly communicated, to the other relevant stakeholders in this. My understanding is that there will be further that this is an operational matter, that it's not likely to have to go to the executive, but that there will be further iterations of these proposals. If so, would members like us to request that we be kept in the loop, on these further iterations, so that we are able to understand what is being proposed, and if we feel that it would be beneficial, to offer observations. Yeah, and would officers be happy with that?
Be more than happy to keep committee up to speed with the development of this reorganisation and the proposals going forward.
Thank you. I beg your pardon?
Do we have to vote that this is noted?
Yes, okay, so Graham has suggested that we take a vote to say that we have noted that report. Those in favour? Thank you very much. Thank you, Graham. Okay, so we've all had a chance to have a look at the work programme. I think one of the primary tasks here, is to ensure that we are very clear about what will be going into the work programme, in particular for the next 2 meetings. Yeah, and some thoughts beyond that. I would like to begin this discussion, if I may, by suggesting that we consider requesting the Executive Member for Children's Services to attend. I would suggest at the next possible meeting of this committee, which I think is on the 7th of September, in order for them to address us with some of their thoughts, about the service, and to answer some of our queries, questions, and so forth on this matter. I think it would be very useful for us to engage formally, with the executive member. Any comments?
In fact, Councillor Brubray did contact me already, and she offered to attend at the committee's request. She's more than happy to come.
Good. And so, Luciane, would you advise whether we would be able to accommodate that in the 7th of September meeting, bearing in mind some of the other items that are already being suggested for that meeting? Thank you. I'd also like to suggest that in that meeting on the 7th of September, when we are to receive the SEND Innovation and Improvement Programme update, I would like us to consider recommending to recommend inviting groups such as Send Voice, who are involved in co-production of that strategy, to take part in that item. And there may well be one or two other stakeholders who were involved in the co-production of that strategy. I think it would be very useful to get their feedback orally, and also an opportunity to ask and hear answers to some of their questions, on that strategy. So that's a formal proposal. Would there be any problems, either from a democratic services point of view or from an officer's point of view, with inviting those stakeholders?
From an officer point of view, I don't think there would be any problem at all in inviting those stakeholders.
I would totally endorse that, Chair. And Ofsted and CQC have just recently published a consultation on the new inspection framework for special educational needs, which is very clear about an enhanced role for the views of parents and carers and the voices and lived experience of children and young people. So it would be absolutely appropriate to engage with parents and carers in that meeting. Thank you.
Thank you, Helen. Graham?
Yeah, just very quickly, because I'm still privy to the past information. That would be very good timing as well, because we're expecting a full Ofsted visit somewhere just beyond that time. And one of the things is about the engagement. We discussed it at corporate parenting, you'll recall. So it is very appropriate.
Thank you. Now, I'm very aware that the meeting for the 7th of September is full, filling rapidly. But I also note that the Children's Services Strategy that was to go to the 29th of September executive has been withdrawn following feedback from the Ofsted focused visit. I'm wondering whether at the 7th of September meeting, whether overview and Children's Services overview and scrutiny could view and feed into a draft of that revised Children's Services strategy.
Chair, I think it would be entirely appropriate for us to update on progress with the ongoing Children's Services strategy. As you rightly say, this is a living document. It is updated regularly, and certainly we'd be in a position to present that to committee in September.
Thank you. Would we all be happy to request that? Thank you very much. And finally, from me, I would like to suggest another area for scrutiny. And because of the urgency, I believe, of the matter I'm going to raise, I would like to suggest that we might consider preparing for this for our 2nd of November meeting. What I'm talking about is concerns about the cost of living crisis. I'm wondering whether we could request a report on concerns, outcomes, etc. of the cost of living crisis affecting many children and families in our borough, and the impacts of this on children's services, including education. I would also like to suggest that if we do go ahead with that proposal, that we would invite the executive member for tackling poverty to that meeting as well.
I think it's a worthy subject. It's a very broad subject. I think that maybe, I don't know how we do this, perhaps we circulate some ideas between us as to what the terms of reference for that could be, so that we make sure that it's relevant to what we're going to discuss and around our children. Yeah.
I would agree with that, Graham. Beth?
Could I suggest that we do that in a fairly good time as well, to allow reports for that meeting? November sounds a long way away, but we know it isn't, to be prepared in the best way that they can.
Lucienne, can I ask whether there's any guidance, suggestions as to how, from Democratic Services, as to how we might handle that? Is there a process? Are there any protocols that we would need to follow, or is it something which we could agree to do informally, and then pass on to?
So when you want something to be discussed, you agree at this committee, it goes into the forward plan. And if you want to specify what you want in the report, we could do that informally. You could send me your ideas, your suggestions as to what specifically you want the officers to report on, and then I can pass that to the relevant officers.
Thank you. That's a very generous offer. As Beth suggested, though, I think there is.
Chair, I just wondered if I could come in here. We are obviously working at the moment on the anti-poverty strategy, and a key element of that involves children's services, and in particular the interface with schools. For example, poverty proofing the school day. I'm just wondering if we could manage the process around those particular areas that would be, specifically relevant. At the next Borough Educational Partnership, for example, on the 12th of July, we are taking the anti-poverty strategy into the meeting to, have a very significant discussion with school leaders about how they can assist and engage in this process. So happy to work with members on how we could structure something very meaningful in this regard.
Yes, thank you. Thank you for that. If members do wish to offer some suggestions as to themes, particular topics and so forth that might be considered, as part of that report and discussion, because I think there is some urgency, on this matter. Could we perhaps agree to forward those ideas and thoughts to Lucienne by the end of the month? Thank you very much indeed. Okay. This is a living document, so each meeting we will come back to it, and add, revise, and so forth.
Briefly, I will have a suggestion as to a new standing item, well, a revised standing item, but I'll come to that when we are in the pink papers.
Thank you. I think I can guess what that one will be.
Yes, I don't know when it will be suitable to bring in, or whether it is suitable, but I'm just wondering whether we should have an update on school transport, because it was such a problem last autumn. Maybe it's too late actually by next autumn.
Assistance policy.
Yeah.
What, January 23?
Yes.
Yes.
Oh right, because the thing is, it all has to be in place for September, doesn't it? But I suppose
For this coming September,
yeah,
everything's agreed and has gone through council, and that's as per the protocol. So this committee to consider it in January is good for the following September. So actually the timing of putting it in 4th of January works.
right, okay.
Thank you, Anne, and thank you, Graham. Okay, agenda item 11, exclusion of the public.